Okay, so we are like, let's say she needs lifting and lowering assist. Okay, so she's either a mod assist, maybe a max assist. All right. So what I'm going to do is have her scoot forward. All right. So we will be transferring over here. Okay, ma'am. All right. I need you to push up from the armrest. I'll have my hands on the gate belt. Okay, lean forward and stand up. Okay, so from here I'm already gauging. Can she push up or am I lifting her up? Okay, because remember with transfer, it's either you're providing lifting or lowering or lifting and lowering. So once she stands up, I'm already gauging how much assist am I giving her. All right, so, okay, now we will turn around.
And then what I do with my hand, what does the client do with their hands when they?
See if you can reach for the grab bar and slowly turn. So I'm already gauging how much assistance can she, how much assistance am I providing as she tries to turn around. Okay, now you can go ahead and sit down, and I'm also grading how much assistance I'm giving. Okay. See what I mean? All right, so that's how we transfer. Then we can push this back so that she has enough room. Transferring back to the wheelchair is about the same, okay? The question is, well, she needs to use the toilet. She still has her pants on. Okay, so let's go ahead and stand up again. Let's go ahead and stand up. So let's say we are at this point off the transfer. So she still has her pants on. This is where I can start assessing for standing balance and standing tolerance. Okay, so see if you can bring your feet apart, so widen your bases.
Oh, okay.
Yeah, there you go. So from here, I have my hands on the walker. I can ask her if she can pull her pants down. Okay, so right now, let's say she can stay standing with hand support. I'll ask her to, okay, see if you can take your pants, pull your pants down. Don't do it though. But as she tries to pull her pants down, she needs to take her hand off the rail. That's what that will tell me if she can maintain her standing if she doesn't have hand support. From here, if she starts to wobble, that tells me that, oh, she can't do it, then I'll probably have to pull her pants down for her. Okay, so when you're, let's say you are assigned to a hospital or SNF, when you're doing the transfers, and it's probably a good idea to have your gloves on, so you're ready to jump in there and help the patient if needed. Okay, so let's say she has her pants down, then that's when you can instruct her to sit down. Okay, reach back and slowly sit down.
So
I should have, yeah, okay. Should have had this down. All right. But like I said, like in my hospital, we only have a rail on this side because over here is a wall. We can use the wheelchair as their as a second handrail, or if they have that raised toilet seat just like that, then they can reach over and sit down. Okay, can you do that? Okay. Okay. Now, well, she's on the seat. She'll have to pull her pants back up. If the person does not have any hip precautions, you can ask them to reach forward and pull their pants up as high as they can while they're seated. And then stand up. Okay, I'll ask her to stand. And from there, see if she can let go and pull her pants up. Pericare. Some people wipe while they're seated. Some people have to stand up and lean forward to wipe, especially our bariatric patients. They probably have to stand up or squat to reach. So that's another opportunity for you to assess standing balance. Can they let go, lean forward, and wipe without any assistance, without falling over? So if this, especially if this is my initial evaluation, I will have my hand on the gate valve. So I can feel for any side-to-side movement. If their knees start to buckle, my hand is already here to hold on. Now, if you're not comfortable doing the transfer by yourself and you need another person for your safety and for the patient's safety, have someone there. Or ask the physical therapist, hey, did you transfer Miss So-and-so? How much assistance? Now, how am I going to grade that? Because if I ask a CNA to walk in, then you have two people. So technically, it's a total assistance. This is where your clinical judgment comes into play. Is the person there for you or for the patient? After your assessment and looking back, you feel like you could have assisted the person just by yourself and then start to grade mod assist, max assist. But if you feel like, yeah, the other person should be there always for safety, so you can grade that person as a total assist because you need two people. Okay, clear?
Yes.
All right, sit down again over here.
I have a quick question. If you ask her to pull her pants up while she's standing and she's unable to do that, how are you, as one person, gonna do that?
Sit down over here again. So that's why I will have her pull the pants up all as far as it goes. Then when she stands up, go ahead and stand up. This is where you learn how to use your legs. You're bracing that pant so it doesn't fall. Then you go hold on to the bar, hold on to the bar. Then I do this one, then I pull it up. Yeah, so I'm not just using my arms, I'm actually using my body weight to stabilize her and stabilize the pants and pulling them up. Okay? Go ahead and sit down.
You guys go through the care then, right?
Hmm?
You guys went through the care?
Oh, not yet.
Okay.
I was doing my spiel.
Okay.
All right, so let's see. Let's do the tummy transfer.
So while she's getting that ready, do you guys remember what the care levels are? What's 6?
I don't know what that is.
It's, you're thinking of the FIM. So the FIM is 7, begins at 7 at the highest, but this is the care, and most places are transitioning to the care now. So 6 is going to be either independent or modified independent, so whether they use equipment or not. What's 5 gonna be? Supervision, yes. What's 4 gonna be?